All right, thanks, Dan. Now, overall rates for stillbirths have been dropping since the CDC's National Center for Health Statistics has been tracking these rates since 1990, but there has been an increase over recent years. News 19's Crystal Flintrop spoke with healthcare officials to learn what could be driving this increase. Crystal?
Dustin, in 1990, the stillbirth rate was about 7.5 fetal deaths for every 1,000 pregnancies at 20 weeks or later. Since then, the rate has dropped to a low of 5.7 in 2019, but in 2020, the rates increased. According to the National Center for Health Statistics, the stillbirth rate in 2020 was 5.74 and stayed at 5.73 in 2021. Mayo Clinic Health System's chair of the Department of Neonatal Medicine says there are a variety of things that could be attributed to this increase for those years, especially the pandemic.
Some things a person, can't change, like their genetics easily. But it might have been harder to see a doctor or a nurse midwife. And I think the pandemic was hard on people's psyche and mental health and social.
Along with social isolation, there are other factors that can contribute to a possible stillbirth as well. Dr. Kostakos says a mother smoking or taking certain medications or drugs, Dustin, can all cause stillbirth at higher rates than mothers who don't.
Yeah, thanks, Crystal. And with the overall stillbirth trend at a decline over the last 30 years in the U.S. and worldwide, Dr. Kostakos says he's optimistic that the trend will continue decreasing in the future.